Very good morning to everyone present over here. I'm Dr. Shraddha from Odisha and would like to present a case of a vitreous cyst, a clinical rarity. So these cysts represent an extremely rare clinical entity which could be either detected incidentally or congenital or acquired. Theories suggest that they could be choriostoma of the primary hyaloid system. They can occur in normal eyes as well as in those with certain ocular pathologies. Patient report transient blurring of vision when the cyst floats in the area visual axis. But surprisingly, our subject did not complain of any such floaters or blurring of vision despite the cyst freely floating in the visual axis. So this was basically a 20-year-old female, a college student by profession from Jajpur district of Odisha, who turned up to our OPD for a routine checkup. There was no recent diminution of vision or any other ocular symptoms. She was detected incidentally with high myopia 10 years back when she was in standard 8 and is wearing glasses since then. And there is no history of floaters or any other ocular trauma. Family history was insignificant. Upon further questioning, there was history of goats as pets in the home. General examination and systemic examination was completely within normal limit. Coming to the ocular examination, she had a best corrected visual acuity of 612 parts in both eyes with the IOP of 14 millimeters of mercury in both eyes. Rest of the external examination was completely normal. Coming to the slit lamp biomicroscopy, the lid and adnexa and the rest of the anterior segment was normal. Upon dilated examination, media was clear in both the eyes with a cup disc ratio of 0.3:1 with a healthy neuroretinal rim with the presence of foveal reflex, and fundus had no other degeneration. But on the left eye, there was a freely floating cyst noted in the anterior vitreous pocket, which was along with the movement of the eyes. It was spherical in shape, smooth surfaced, about 2 × 2 mm in dimension, light brown in color, non-pigmented. And surprisingly, the patient is not complaining of any visual symptoms. So we did further imaging. These are the various pictures in the anterior segment imaging, and the fundus photograph was again completely normal. Upon the B-scan imaging, we found a 2 × 2 mm cystic formation in the anterior vitreous pocket with hyperechoic walls, which was freely floating and did not have any attachment to any other ocular structures. Upon complete blood count, it was completely normal with a hemoglobin of 10 gram percentage. Blood serology test, that is the IgG and IgM, were negative for Toxoplasma gondii. ESR was significantly raised. Stool routine microscopy was negative for protozoan ovae. VDRL was negative. NCCT brain, chest X-ray PA view, and CT scan abdomen and pelvis was completely normal. So as the patient was completely asymptomatic, she was followed up for 6 months with regular assessment of visual acuity and fundus examination and also stool routine microscopy. But yes, symptomatic cysts are managed by laser cystotomy by argon or Nd:YAG laser, pars plana vitrectomy with cyst excision. So to conclude, we presume this to be a case of congenital vitreous cyst associated with high myopia, which is completely asymptomatic without any ocular attachment. They can be congenital or acquired. If acquired, they can be reported secondary to ocular trauma, intermittent uveitis, toxoplasmosis, and echinococcus infection. They could also be associated with retinitis pigmentosa, choroidal atrophy, retinoschisis, high myopia with uveal coloboma, and retinal detachment surgeries. However, there was no such association, and surprisingly, congenital cysts are also considered to be remnants or choriostomas of the primary hyaloid system, and they could be in conjunction with a Mittendorf dot or a Bergminister's papillae, but there was no such association in our case. Thank you.
I think it's a very good presentation because of simple observation. Sometimes when you see something, you are itching to remove it. So we learned that in case of such, we're treating the patient's symptoms and not the signs. So patient has no symptoms, so nothing to be done. Thank you.